Good morning, everyone. It is Tuesday morning, it's 10 o'clock, and it's time for the Traeger Institute weekly coronavirus virtual information session. We welcome you all and hope you will enjoy the time with us. Please keep your microphones on mute and keep your video off if you don't want to be recorded. Otherwise, you're fine to keep your video on. Type your questions in the chat. We will then, as it's been put in the chat, we will try to answer the questions. Please use respectful language, and if you are concerned about your health, those are numbers you can call, 588-4340, or you can call the COVID hotline at 1-800-722-5725. Just make sure that if you look at the lower end of your screen to the left, there's a place where you can unmute yourself if you want to say something. And that's also the place where you can put your video on and off. And you can test your sound system there. Now, in order for us to, again, have a little bit of a idea where everyone comes from, I would like for you to just type in the chat the county you represent. That will help us to see, you know, who we are reaching. Thank you. So today we're going to start by asking Dr. Furman, our medical director, to give us an update again about where we are with COVID-19 before I'm going to introduce our speaker.
Hi, I'm Dr. Christian Furman. I'm the medical director here at the Traeger Institute. And yes, thank you for giving that number, Dr. Falls. So if anybody has any questions, you can always call us at our office. It's 588-4340. But today I just want to talk about we're starting back to work, healthy at work, and I want to kind of explain that a little bit. I think I've had a lot of patients, and we've talked about this as a leadership team, you know, how can we go back to work when the virus is still out there and nothing's really changed? But what has changed is that we have the testing capability now. Pretty much, you know, we can send all of our patients. There's lots of places to be tested. So people that we need and want to be tested can be tested. So that's a big difference from when this virus first came to be. We didn't understand the virus. We didn't have the capability. We didn't have the infrastructure. So it was like just shut everything down so we could all just figure this out. Well, now we figured it out. So now we can slowly open things back up. So, you know, we are opening up our office slowly. So we have the PPE now. We're able to get the mask. We're able to get the gloves. We're able to get the gowns. So that's why things have changed, is we have the PPE. It's changed because we have the testing. It's changed because, you know, we've all done a great job. You know, Kentuckians have done a remarkable job, and we never had this huge, big surge. It just was a plateau. And so we know we have the ICU capability, we have the ventilator capability, we have the hospital capability, we have the personnel capability. So we have kind of our ducks in a row now. So I think now is why the governor is saying that we can start reopening things. But it is scary, and I think it's good just to acknowledge that because really the virus has not changed. We understand it better, and we understand how it spread better. So we do know that you need to wear a mask when you go outside, unless you're totally by yourself and there's no one around you. But if you're going to run into people, you know, you think, oh, I'm going to stay 6 feet away. But what happens is there's this drift. And even, you know, you think you're 6 feet away, I've had doctors and nurses come up to me and touch me. I'm like, please don't touch me. Why are you touching me? You know, so people just forget, and you go back to your old habits, and people just make mistakes. And so the way to protect against that is just to wear a mask at all times. So if it's a healthcare provider, we have to wear a surgical mask. But if it's just lay public, going to the grocery store, there's a good video on our website. There's a good video on the governor's website about how to make a mask with a bandana without having to use a sewing machine. You don't have to know how to sew. You just fold it, fold it, fold it, put rubber bands around it, or ponytail holders, and it goes over your ear. So if you need help with that, there's places online to find how to get a mask. So we ask everybody to wear a mask. The reason you're wearing a mask is that you could have the virus. You could be an asymptomatic carrier. You don't even know you have it. I mean, you feel fine, everything's fine. And so you wear the mask to be compassionate towards others, so you're not spreading it to other people. And then once everybody sees everybody wearing a mask, and everybody will be wearing a mask, and there has been research to show that that does decrease the spread. If you're actually doing a procedure with a COVID positive person, you know, there's a whole different thing, but we're just talking about going out in the community. Everybody needs to wear a mask. And then I think I just want to emphasize that our office, and the way most offices are doing it, is we're really emphasizing telehealth. Telehealth is still the best way to go. You know, Governor also says telework is still the best way to work, because we just don't want all these people in the clinic. We can't have that many people. So we're just having one provider. You know, sometimes our office would have 3 or 4 providers. So now we're just having one provider being the in-person provider in the mornings in our clinic. And our clinic is still just doing that in the mornings. Maybe at the end of the month, we'll have one provider all day long. But for right now, our office is having an in-person provider on Monday, Tuesday, Thursday, and Friday mornings, and on Wednesday afternoons. And our lab is open. We're staggering people coming into the lab because we don't want everybody coming at once. And so each patient, depending on their provider, comes at a different time. So that way our lab is open from like 8 to 2, Monday, Tuesday, Thursday, Friday. And then on Wednesdays, it's open. It starts later and it's open till 5 on Wednesdays. So we're still having people wait in their cars. We're still limiting visitors, just no visitors, nobody accompanying the patient to the office unless they have to have a person accompanying them because of dementia or mobility issues. And you can have one person, but you can't bring the whole family. It's like the other day, we wanted to have the whole family. So we just called them on the phone and we did a virtual way. So we're still doing telehealth. That has not changed. Our staff now are in the office all day. So that has changed. And we're not doing the working from home as much with our staff. Our staff is our ULP staff, our clinical staff are actually in the office now. So I think those are the things I wanted to cover. The other big thing I wanted to cover is the month of May is Older Americans Month. And so please celebrate Older Americans this month. Also, this week is National Nurses Week. So we know the nurses are the backbone of the healthcare system. So we appreciate all of our nurses. And also this week is Long-Term Care Week. And so I'm medical director at Presbyterian Home. And to celebrate all those things, on Thursday at 2 p.m., Presbyterian Home is having a parade, drive-by, appropriate PPE and appropriate social distancing. Presbyterian Home is on Mutual Bank Road, kind of the end of Bardstown Road. And so if anybody wants to come at 2, the residents would appreciate it. The residents that can are going to go outside. Everybody's going to be 6 feet apart. Everybody's going to have a mask. And the police and the fire department are going to lead the parade. And we're going to just drive by and everybody's going to wave at the residents and say thank you for Older Americans Month, to say thank you for the nurses, to say happy nursing home long-term care week. And so, decorate your car, bring your horns, honk your horns, and it should be hopefully a time to celebrate everybody. So if you have any questions about that, you always can call our office. And I think that's it. And then I'll be available for questions at the end.
Thank you, Dr. Furman. Now it is our greatest honor to introduce you to Commissioner Victoria Elridge. She is the Commissioner for the Department for Aging and Independent Living under the Cabinet for Health and Family Services in Kentucky, and she's also a licensed occupational therapist. She previously served under Governor Steve Beshear and Matt Bevan as the Deputy Commissioner of the Department for Aging and Independent Living. During her previous tenure with DIAL, she worked to ensure state and federal services for Kentucky seniors and persons with disabilities were delivered appropriately to ensure independent living through contract negotiations, revising and updating state regulations, and overseeing the state guardianship patient program of 4,500 of Kentucky's most vulnerable citizens. Commissioner Elridge grew up in Louisville, Kentucky, and is a graduate of Eastern Kentucky University, where she holds a bachelor's in occupational science and a master's in occupational therapy. She currently resides in Georgetown, Kentucky, with her husband and their 3 sons. And they have a very divided household, where she loudly cheers for the Louisville Cardinals and her husband and 3 sons cheer for Kentucky Wildcats. I think there's a lot of households like this, but welcome, Victoria, and we are really looking forward to hear from you.
Thank you, Dr. Fall. I greatly appreciate it. And I want to say welcome to everyone. Thank you all for having me. I look forward to a lively discussion. And as I've gone and done a few of these different discussions, I was coordinating with Natalie and she said, we really don't have to do a PowerPoint. And I said, oh, thank goodness. In this day and time, I think having just good, honest discussions is wonderful. And that really helps get the information out there and going. And as I share different pieces of information, I'll post it up on the group chat or send it to Natalie to get out to everyone. But first I want to say thank you again for having me. I have been in my role as commissioner for the Department for Aging and Independent Living 2.5 months, and what a 2.5 months it has been. I started on February 24th, and about 2 weeks later, Kentucky had its first positive case of COVID-19, and that's all that we have been living and breathing in Kentucky and up in my department and in the cabinet as well. And with that, the Secretary Freelander sends his warm wishes to everyone on here as well. And as you all know, Louisville holds a special place in his heart. And as in mine as well, born and raised, went to Fern Creek High School, and then went to EKU to follow my dream as being an occupational therapist, and met my husband, and he said, there's no way we're moving back to Louisville. And I said, well, I'm not moving to Cynthiana, Kentucky. So we agreed on Georgetown, Kentucky. So here we are. So I have to share with you all, the department has been phenomenal in their response to COVID-19. We work closely with all of our different area agencies on aging and independent living. And up in the Louisville area, you all have the KIPTA area agency on aging and independent living, which is housed in the area development district. And I cannot tell you all the response that we have had from the community, just the number of volunteers that have come out to help to see how they can help seniors and individuals with physical disabilities. We are monitoring the meals that are served out into the community to seniors. And we hit a new record last week. There were over 78,000 meals served to seniors last week, and that was statewide. It was phenomenal to see. Meals have been increasing. We've been watching the trends. They're anywhere between 4,000 meals to up to 8,000 meal increase week to week, which is phenomenal, knowing that everyone is getting the nutrition that they need. Individuals are staying healthy at home, and individuals are accessing these meals through a drive up to their senior center to receive their meals, or they have their meals that are delivered to their home. And as COVID-19 started initially, when there was initially the discussion of how do we social distance, I really looked at our senior centers, and I advised the secretary and told him, I said, there is no safe way for us to social distance in our senior centers, and made the recommendation. And he discussed with the governor, and the governor agreed. And so since about middle of March, our senior centers have been closed, but our senior center staff have been phenomenal. They've really thought outside the box as to how can we get our seniors the meals, but also engage in those different activities. And so we have staff and volunteers who are calling seniors to make sure they're doing okay, figure out what they need. Different communities have stepped up and started doing either mobile grocery stores. And I know in the Louisville area, you all initially had like a Dare to Care grocery mobile. And then there's also been different entities have stepped up and said, hey, we'll run to Kroger, we'll pick up the quick list groceries for you all and bring it to your house. And so it has been phenomenal. There have been jails who have said, hey, you can use our large kitchen to help get meals out to seniors. We've partnered with Head Start entities. We've also partnered with, in some of these really small towns in Kentucky, we have your gas station is your local hub. And the gas stations have said, hey, we have a large kitchen here. We can help prepare meals and get meals out. And on average, we typically serve pre-COVID about 8,000 meals to seniors. And since COVID has started, we've had an increase, and we are serving anywhere between 14 to 17,000 meals a day to seniors, which is just phenomenal if you think about the mass effort that it takes, you know, all of the volunteers that have come into play, all of the food providers, the food prep. And not only within the meals, we still have our services in our our person-centered services to allow individuals who are aging or individuals with physical disabilities to receive attendant care services to stay in the home. And there's a few different programs that we have within our department, but the main goal is to really ensure that individuals with disabilities or individuals who are aging can stay in their home and just receive a little bit of assistance while still being active in the community. And so with that, we've been monitoring. There have been some seniors who have said, you know, we would like to put our services on hold while we get through the COVID pandemic. And we also want to, some seniors have said, I need to continue to receive services. And so the individuals who are going out into our seniors' homes, we recognize them as truly frontline workers and are grateful for the work that they do, because we know if it weren't for their work, then our seniors would require a higher level of care. And so with that, we're just so grateful for these partnerships and the work that they do. And they truly are the unsung heroes, whether it's making sure that seniors have food, prescriptions, their homes are clean, their laundry is done. It's an array of services that they are providing with that. So, that's on a very large scale what's going on. We also have within the department, we have state guardianship. As Dr. Fall, as you had alluded to, I like to say I proudly am a mother to 3 boys at home, but I say I'm a mama to 4,800 guardianship clients across the state. And these are individuals who no one else has stepped up to assist them in making medical or financial decisions. And these are individuals who through the courts have been deemed unable to make decisions for themselves. And so we have been working closely. COVID has really impacted them as they have multiple medical complexities as well. And so they've been impacted as well, as you all have heard, in the long-term care settings. And so we're closely working with them to make sure they have what they need while social distancing and using a lot of virtual technology. So there's a lot of what's going on here at Dale. So I'm open to any conversations, or if you all would like more information on different services and programs, I'm open to having a great discussion within that. So with that, Dr. Fall, I'll turn it back over to you and figure out the best way to get information out there.
Thank you, Victoria. I really appreciate you and your discussion about everything you're doing. I want to start with a question that I have that I also put in the chat. And what we have experiencing a lot is the social isolation that's currently really rampant in our communities. What can we do? What can we as citizens of our communities do to deal with the social isolation that so many older adults are experiencing?
That is a great question. And that is a question that we are exploring at the state level, at the national level, and at the local level. So it is a very, it is a question that we are exploring on all different levels. With that, we have really pushed this idea of seniors adopting seniors. One of the first things that I had come up with was a plan to partner with seniors in high school who could connect with seniors in the community or in long-term care settings, and building those relationships, having neighbors check in on neighbors. And it really has, COVID-19 has brought numerous negative aspects within our community, but has brought numerous positives as well. And so with that, we're working with our area agencies on aging and independent living to increase a virtual presence. We are looking to see which seniors have access to virtual technology and those that don't, and figuring out a way to set them up with telephone calls with neighbors. I see that Samira had posted some different entities as far as getting meals out using Nextdoor. And Nextdoor, I've really seen in all of the different social media platforms, have given community members a chance to step up and help out. But again, there is nothing better than picking up the phone, making a phone call, checking in on your neighbor, seeing who needs assistance with getting groceries or even pet food. We've had in Western Kentucky, as you all know, they have been ravaged by COVID-19. Just the numbers continue to increase, especially out in Muhlenberg County, where the Greenberg Correctional Complex is, in Warren County as well. And so different entities are stepping up to help out. But one of the things that we don't think about it, there has not been as much focus on, is a lot of our seniors have pets. And so there have been different entities who've stepped up and said, hey, let me get you some dog food. Does your dog need anything? Do they need some treats, or does your cat need treats? Different aspects as far as making sure that their pets are taken care of. And so it really is figuring out how to best communicate, figuring out what's important for the senior. And I'll tell you, this is where I put on my occupational therapy hat and really focus in on what's important to this individual, not what's important to me as a volunteer to help, but what does this individual need? And truly asking the question, how can I help you? instead of just giving them different ideas, but figuring out what is it that you need. Is it that you may need some denture cream, you know, some Depends. Is it that you need some assistance with cleaning your house? You know, now is a time that a lot of different individuals would be gardening, and giving them, you know, you may not be interacting with them face to face, but at least coming out and helping them with their yard is really important. You know, flowers are, you know, pretty inexpensive, but the value that it gives them, knowing that someone is out there caring for them, can definitely help. So there's a wide array of activities that we could do to help combat social isolation, but it truly is being able to check in on your neighbor. And it really does get back to that heart of we as neighbors in our community figuring out what we need.
Thank you. Any other questions anyone has?
This is Christian Furman. So I just have a question. I forgot. So you're kind of know about the guardianship program.
Yes,
and one thing that I think just in general, but especially during this COVID pandemic, is to make sure all these patients that have guardians have an advance directive. So I don't know if there's been any way to systematically, you know, it's hard enough when there's not COVID to try to get the guardian, have this face-to-face conversation about goals of care. But are you able to use technology, or are the guardians doing that? Just kind of try to talk, you know, using telehealth with the guardians to have these advanced care planning conversations with the providers? Is that happening more, or do you all need that technology? Or
so one of the things within state guardianship, we have plans in place that as soon as a guardianship client comes under our care, that is one of the first things that we look at to see is if they have a previous advance directive that was already on file prior to coming under our custody. And if not, determining what's the most appropriate need. Some of the individuals that come under our custody are individuals who've been in nursing homes and who had been up until able to make their own decisions, but have had some medical complexity that has arisen that they're unable to. And so we work with them and try to find family to determine what their best needs are. And actually, one of the things that we had done last year under my predecessor, which is a fabulous idea, is everyone talks about tax day. And I know that there was a big push as far as using tax day to be advance directive day, but making sure families have the information needed, that seniors and our elders make it known what is needed, what their wishes are. And as we know with COVID-19, it touches all people across the spectrum, as the governor had alluded to last night. And with that, though, what we do know is individuals who are 60 and older are more susceptible, but really it has really hit the individuals ages 80 and older, that if you were to contract COVID, the death rate is significantly higher. And you can go on to KY COVID-19 and the website there's you can look at trends, and that more women than men contract COVID, but more men pass away from COVID than not. And so, you know, whether it's COVID-19 or any other you know, health ailment, it's always a great idea to make sure that you have your wishes known and your advance directives in place, but not only to get them in place, but to let family or friends know where they are within your home should they need them.
I think that's a great idea, because, you know, you hope that the provider is reaching out to the guardian, but I think if we could have a systematic way that the guardian reaches out to the provider to make sure everybody has an advance directive, it's hugely helpful to do it ahead of time instead of during the crisis situation. So yes. Yeah, thank you. That's really helpful. Well, and then also, I think Joy Table. Yeah.
Oh, I was just going to add into that. Within that, I know a lot of these documents have to be notarized, and there is now through the actions that the governor has put into place that you can do telehealth notarization. I know some entities are still doing notarization, such as your UPS store, but you can do electronic verification through notarization.
Yes, and we have that capability at the Institute, and like Joy Table was just saying that elder law attorneys can do that too. So that was hugely helpful for the governor to do that, for sure.
Yes. Yeah. Thank you. I want to ask Dr. Joe, our Director of Wellness, to share a little bit of what he's seeing in his therapy patients. You know, he's seeing a lot of older adults living alone and in this pandemic. You want to share some light of what you are seeing, what's going on?
Sure. First of all, let me begin by saying that I've been really impressed by the resilience of all of my patients that I've been seeing. It's amazing to see how, in spite of social isolation, they're still pushing through and figuring out how to best serve themselves during this time. One of the things that keeps coming up with social isolation is the lack of contact that they're getting from the outside. They've been saying that, yes, they've been getting a phone call here and a phone call there, but to actually stimulate their brain cells, the only thing they've been able to do is watch TV. Some have logged on to different websites and try that. But I noticed that the older that my patients get, the harder it is for them to do that. So I think it's important for us who are out there in the workforce, I think like Victoria said, to actually reach out and make that contact. I have tried to actually ask my colleagues to contact some of my patients just to say hello, just to have a conversation. And if all of us could, there's 48 people on this. If you can call one person a week, that's 48 older adults that will have a weekly call just to say hello and getting to know them, because it is social isolation. There's enough research on it to show that it's really detrimental to health. For all of us that are on this site right now, one of the things that I'm finding too is that a lot of my patients are falling out of their routine. So I recommend for everybody to make sure you keep to your routine. And that's getting up in the morning, doing what you normally do as if you would go to work or go out, but really to really maintain that routine. I'm finding that that's been real helpful for everybody right now. I had a Zoom meeting this morning and I was busy and I texted everybody and told them I was stuck in traffic. I thought that was a great excuse for the morning for me.
I was just going to tell everyone about that, Joe. I'm glad you jump ahead and told people you can still use all your old excuses. It's totally fine.
Yes, for sure. But reach out to an older adult. I agree with Victoria. I think that if we could do that, even someone that we don't know that well, I think that will really help them to alleviate social isolation. If you're in a neighborhood and you can cook cornbread and leave it on someone's front porch, do it. Just do it. Just randomly do it. Whether they eat it or not, it's not going to matter. It's the point that they're getting that contact and they know that people care for them.
Yeah. Thank you,
Thank
Dr.
you.
Joe. I'm now going to let it over to Justin to read some of the questions in the chat. And I also want to say that there's a lot of resources that people put in the chat, and Natalie is going to put it on our website. So you will be able to have access to those. But maybe, Justin, you can just mention a few of these.
Okay,
So
yeah,
over to you.
Thank you, Dr. Fall. And Natalie is going to be posting these resources on our website. I'll start with a question, and this is a two-part question that kind of go together. Samara asks, how can someone sign up for the senior to senior program that was mentioned, connecting high school seniors with seniors? And then Joy asks, any groups we can reach out, church, senior ministries, civic clubs, to create a list for volunteers to make phone calls, cards, etc.?
So Justin, can answer the seniors helping seniors. That is something that we are piloting within the Department for Aging and Independent Living. What we are doing is different schools across the state have what's called a HOSTA group. It's a health occupation student activities group, but these are actually seniors in high school who have said they want to go into the healthcare field. It could be seniors who are nursing students, occupational therapists, future physicians, just students who have identified that they are interested in the healthcare field. And so we initially are looking to partner for that. But Samira, I will, you can email myself, or I'll tell you what, I will put my phone number up here. You can call our office and we can get you in contact with the individual that is coordinating that. Our office number, and I'll put it in the chat as well, is 502-564-6930. And Marnie Mountjoy is our aging assistant director, and she is the one who is coordinating that and can put individuals in contact as we get this rolled out. And then to the other question, to Joy's question, and just wanting to share with everyone, and I recognize that there are some individuals who are not on virtually, but who are on via telephone. And wanted to share 2 phone numbers that are of great resource for seniors. Our first is our Aging and Disability Resource Center hotline. And this number is a statewide number. And when you call it, it will geo-route you to your local Aging and Disability Resource Center, and you can get signed up if you need assistance with meals or in-home services, or additionally assistance with your Medicare premiums as well. That number is 877-925-0037. And again, I will put that over in the chat box for those of you that are on here virtually. And then I know Natalie will also post it online as well. So with that, I'll turn it back over to you, Dr. Fall.
Thank you, Justin. Any other questions?
I think that's it on the questions right now. Rachel chimed in that AARP does have a community connections site that allows people to find or start mutual aid groups in their community. And you can also request a call from the Friendly Voice volunteer, and there is a link in the chat. And basically she just comments that sometimes just hearing a friendly voice, and this kind of echoes what Dr. Joe was just talking about, can be really helpful in these challenging times.
Are there any questions for our medical director or anything else about older adults in the community?
Dr. Fall, this is Victoria again.
I just wanted to say this is Christian Herman again.
Our department go ahead, Christian.
Go ahead, Victoria. Go ahead. Yeah, go ahead, Victoria.
I just wanted to add in, we have our long-term care ombudsman for individuals who are on the call who may have loved ones that are in long-term care settings. We have our state long-term care ombudsman office, and within that, our ombudsmen act as advocates for families who have loved ones in long-term care settings, and they have been extremely active during this time in helping families to ensure that they have the equipment needed for virtual visitations or for window visitations. And so within that, if you do have a loved one who is in a nursing home, and if you are having difficulty either getting in touch with them or ensuring that they have what they need, you can always contact our long-term care ombudsman. And this is another number, and we'll put it up as well. This number is 1-800-372-2991, and I'll put this in the chat as well. It looks like Essie has put in the number for the KIPTA office, but the number that I had read off is for our statewide ombudsman. So if individuals are living in the KIPTA region, in the Louisville region, but have loved ones across the state in long-term care settings, the 1-800 number is the best number to reach at. And just wanted to let you all know that they are there to be a voice and to help you. I'll tell you personally, we had to use an ombudsman with some assistance for my grandmother in a nursing home. And so they are a phenomenal resource.
It's funny, Victoria, you're going to mention nursing homes, and that's what I was going to mention too. You know, I'm still, the long-term care task force, the governor's long-term care task force is still going on. We're meeting today. And I just wanted to let everybody know on the call, and the governor's mentioned this, but systematically the state is going through each nursing home and personal care and assisted living and testing every patient, every staff member. And I think that's kind of scary to some people. It's like, oh, we don't want all these tests, but it's a good thing. You don't want to just put your head in the sand and act like this doesn't exist. Or like, I was on a call with Mayor Greg Fisher the other day, and he was like, oh yeah, just if you cover, it's like a 2-year-old, if you cover your eyes, you don't see it, you know? No, we're not going to do that. We're going to be professionals. We're going to know, you need to know where COVID exists so then you can deal with it, right? So it is kind of scary, but it's good. Every facility is going to be tested, and they're going through systematically, but it brings up a lot of issues, because then if you do have a lot of staff that test positive, and then you don't have enough staff to take care of the patients, and it's just a domino effect. but they have, they've thought this through. We're systematically testing facilities and going through it in an orderly way and having a plan to deal with all the positives that come up, because there will be positives. I mean, there's asymptomatic people that are positive. So I think that's why Kentucky's doing such a good job. We're kind of staying ahead of the curve, and we're systematically doing all this. So just beware, don't freak out, when your loved one is at a facility or you personally work at a facility and you start hearing that your facility is going to be tested. Everybody's going to be tested. So it's a good thing. And we just, want to be positive about it and be professional about it and be leaders and show that this is the right thing to do. And then I think Dr. Joe asked about, yeah.
I just want to ask Victoria, if now with the governor who's starting to reopen the economy in Kentucky, what's your message to older adults living in the community? What should they do?
So I will share that the governor has been very vocal in ensuring that we protect our seniors. I know I've done a few different videos on the Cabinet for Health and Family Services that are out on the Facebook page to getting messages out to seniors to know that we are here. We want to protect you. And I wear a mask not for myself, but for you, for each of you, because I want to make sure that I am able to help our community. But my message to you is, please continue to follow the steps as the governor has talked about, being healthy at home. There are different entities who have set up senior hours, different grocery stores. I know some restaurants are looking at this as well as they reopen. But it's always good if you are interested in getting back out into the community and accessing some of the different services that are opening up. Call ahead to see, do they have what are their plans to reopen and what are they doing to protect seniors? I'll tell you, one of the biggest areas that we have received a lot of comments on are hair salons. And I know we are two and a half months into this. My hair has gotten longer. I'm trying to figure out how to style it. In all honesty, my gray hair is coming through. I say it's God's natural highlights. But salons are one of the biggest things that individuals are wanting to get back into, and barbershops as well. I'll tell you personally, my husband has cut all three of our boys' hair. You learn to make do with what you have. But really, call your salons and see what are their plans that are in place. What are they doing for seniors? Reaching out to them. As far as the long-term care facilities, that is being treated differently. We know within the different communities, that vulnerable population is highly vulnerable, as we know when we look at the statistics. And so as the state looks to open back up, those policies are for public front-facing buildings. Those policies don't apply to long-term care settings. So please keep that in mind. If you see that there are individuals who are not wearing masks per the governor's request that went into effect yesterday, it is okay to leave, to walk out. It is also okay to call the store and say, hey, I've seen this. I'm really concerned. What could you do to help me to ensure that I get the services that I need? But really being that voice and being that advocate, not only for yourself, but for other seniors in the community. So
thank you. That's very helpful. Thank you so much, Victoria. There's one more question, and that's related to antibody testing. Christian, you want to comment on that?
Yes. So Joe, and just to follow up too, I think Amy Crittenden from Oasis Senior Advisors was just saying in general about the testing that, the senior living communities have been proactive in the Louisville area. So that's good to hear, because I'm not at all, I know Amy, you're at a lot of them. So that's good to hear. I think everybody's on the same page. So yeah, this antibody testing, it's a blood test, a test for IgG and IgM to see if you've been exposed to COVID in the past. And we are using the antibody testing. Now the hospitals are doing outpatient procedures, and everybody that has these procedures have to be tested. And tomorrow they're starting to do inpatient procedures, and everybody that's having a procedure has to be tested. So, there's not as much of the nasal pharyngeal testing out there. There's more. They want to do both. They want to do the antibody testing and the nasal pharyngeal, because if you do all nasopharyngeal, just this, testing through the nose, there's just not enough tests, but with the antibody test, they have enough tests. So there's a lot of the surgeries that are being planned, they're using this antibody test beforehand to make sure the patients that, or just to kind of figure out the status of each of the patients. We cannot do it in the office now, but they're doing it in the hospitals now. So it's out there, and there's different, antibody tests, and some are better than others, but they have a pretty good sensitivity and specificity, enough so that we're using them in the hospital. So it just depends, each provider will decide on the situation if you should get an antibody test or you should get a nasal pharyngeal test. So yeah, it's out there, and it's just not in the clinics right now.
Victoria, we have one more question that is related to when will the senior centers open again? Do you have any idea on that?
That is a great question. And I'll tell you, the Administration for Community Living, which oversees our Older Americans Act dollars, in turn, they're the funding stream for our senior centers. They have released some initial guidance and recommendations, but as far as Kentucky goes, we do not have any plans in place for reopening. We are going to continue to support seniors to stay healthy at home and to continue drive-through meals pickup and home delivered meals. We feel at this point in time, honestly, we want to see how our community reacts with this slow opening before we even think to put our seniors at risk. And so we are ready to open our senior centers at this time. I know that the work that they do is invaluable to the community, but if we're protecting our seniors for them to stay healthy at home, then we're going to continue with that. And I will say there have been a lot of senior centers across the state who have been phenomenal at coming up with different ideas to engage. I know some are doing with writing different bingo numbers on the meals. Others are doing scavenger hunts for seniors. And this gives them the opportunity, as the meal delivery driver drops the food off, the senior is given instructions on, showing the meal delivery driver different scavenger hunt items within their home, such as, a picture of them when they were younger, and looking to see if they have cleaning supplies, a family heirloom, but just different ways to engage. And so we're really figuring out how we can bring the senior centers to all of the homes of seniors, still maintaining that contact. I know a lot of senior centers are also doing virtual group activities as well. So it's been phenomenal at how individuals have responded to that. And as Dr. Furman had said, I will make a shameless plug, as the governor has said, if you have not been tested, there are, I think, over 50 sites now that are available to go and be tested for COVID-19. And so, I encourage your families to go and get tested to see, if you are positive, asymptomatic and positive, because the last thing we want is, as families are starting to get back together, under the governor's direction, we want to make sure that families aren't coming into your homes being asymptomatic and not knowing it and passing COVID on. And so I encourage you to go to the KY COVID-19 website to find a local testing area across the state, or one that's in your community, and encourage you and your family to go and get tested. Your friends, individuals at your churches. Churches are open now. Encourage everyone to go and get tested. It's the cool thing to do now, just like wearing masks are. As we had alluded to earlier in the conversation, if we start to see more people wearing masks, then we become self-conscious and we want to wear a mask too. Just as, as we see more people going and getting tested, we need to go and get tested to protect ourselves and our family.
I cannot reiterate what you just said more. I have done that myself. I went to get tested due to a variety of reasons, and it's so well managed and organized and orchestrated. We should all do that. It's really, I want to say, great job to the governor for making these tests available for people who are asymptomatic. So thank you for that. There's one more question from Colby. It says, how useful is one-time swab testing at this point? Won't frequent testing be needed the more we open up? A person could contact COVID the day after a test and never know. I agree, Colby. That was my question too after I got tested. So anyone who wants to make a comment on that?
Yeah, I think that's an issue that I don't think we have really clear guidance right now. I mean, I think it's definitely, like you said, it's worth being tested, but then how frequently do you get tested? The symptoms have changed too. It's, it used to be just fever, cough, shortness of breath, but now it's also muscle aches. And also, just to be clear, a fever in an older person is 99 degrees. So the American Medical Directors Association, all the nursing homes are using 99 degrees. So an older person's different, and mental status changes in an older person, that could be COVID. But anybody, nausea, diarrhea, vomiting can be COVID. Muscle shakes and, just shaking, chills, and also muscle fatigue, headache, and also loss of taste and loss of smell. So definitely, like, if you have those symptoms, you get another test. But I don't know, I don't think we have good guidelines exactly how often should everybody be tested. Definitely it's worth doing it once, but then if you have the symptoms, of course, get tested again. But I don't think we have good guidelines unless somebody else has heard. I think that's to be determined how often people get tested.
And Dr. Furman, thank you for bringing that up. I know we've had some talks with the CDC, the Centers for Disease Control, and that is one of the things that they have found with their studies is that for seniors, it's not the fever and cough that's the first sign. It's the fatigue. It's the gastrointestinal symptoms, specifically diarrhea. Those are in the muscle aches. Those are the really early signs that something is wrong. And then later the fever and the cough and the respiratory distress arise. And so I know we oversee assisted living communities, and we have done lots and lots of education with them in town halls on, yes, it's great to do temperature checks, but by the time they have a fever, they probably have had some other underlying symptoms that we just tend to maybe brush off. But those are some of the early signs. So I, stress that if you aren't feeling quite right, but don't quite have a fever, please stay healthy at home, and call your medical provider to follow up with them. And Colby, this is a great question. And this is something that we're looking at as well, but it is, doing testing in all of our long-term care facilities, but it is, okay, you've done the test. We at least know that you're not active now. But if someone brings it in a few days later, it's a very valid question, and one that we're looking at. I know Dr. Stack has talked a little bit about that in the words herd immunity, and that is honestly above my pay grade. I understand it at a very high level, but that is something that we are looking at. But at this point, we want to make sure that anyone who wants a test can get a test. And so, again, I encourage each of you to go and get your test, encourage your family, your friends to go and get tested first.
And this is Christian Furman again. Natalie Pope asked me to talk about the long-term care task force. So I'll just give an update of what we've done so far. So the big thing is the transfers to and from the hospital and the long-term care communities and assisted living and personal care. And the big take-home message of that is that, really we'd like everybody to be tested at the hospital before they come to the long-term care community. If possible. Most hospitals can do it now, so it's not as big a deal as it used to be. And then we're asking all the long-term care, assisted living, personal care to keep people isolated for, separated for 14 days and before they're becoming part of the general community. But they're still doing, there's not communal dining, there's not communal activities, everybody's staying separate at these facilities. And so that's one thing that we have these guidelines, and you can get it on the website and see all the guidelines for transfers. And also we did original guidelines, and then we've done updated guidelines, and then we've also done to get the emergency kit to have more opioids for the shortness of breath that occurs when people really don't want to go to the hospital. They want to stay at stay at the nursing home, long-term care facility, and potentially die at the long-term care facility. And they've already said that even before COVID. And then when they get COVID, they still don't want to go to the hospital. So we want to have the right medicines for palliative care at the facilities. And so the emergency kit has been changed so we can have more medicine at the facility, which has been really helpful. And then what we're working on now is just palliative care guidelines, just because some providers at these facilities really haven't had to do that much palliative care, and now they're doing more palliative care, and just to know how to dose the opioids and how to have a logarithm to know how to treat people with palliative medicine. The other big thing was there's a 1-800 number, so all the long-term care facilities, personal care, assisted living can call a number if they have any questions. So really trying to support the long-term care, assisted living, all the facilities, so they have good resources. There's also the task force didn't do this, but the governor had already set this up through public health to have all the PPE. There's a number that they can call to get PPE, which is really helpful. So yeah, if you all think of other things, I'm happy to bring them up at the long-term care task force meeting. I know we're talking more about having telehealth in long-term care and how to get that. So a lot of these long-term care facilities don't have iPads or computers with video monitors, and trying to get that set up, we can get more of those devices in the long-term care community, so you don't have to go out and see the orthopedic surgeon, you don't have to go out and see all this. A lot of the going in and out from long-term care is dialysis patients going back and forth a lot. So you can't really help that, but we're trying to do more telehealth so you don't have to go back and forth as much. So really, I think, some of this it's highlighting the issues in long-term care, but it's also pushing us to do some of this technology stuff that really, we've wanted to do for a long time. So now, we're forced to do, which has been a good thing.
Thank you, Christian. Is there any other questions, or are we done? Seems like most of the questions have been answered. Victoria, you have been a tremendous support for us, and thank you for the great information you provided, and just for the nice conversation that we were able to have.
So there's another one from Justin right now.
Yeah, he's just saying, if you or someone you know are providing care to a loved one who is 60 or older, we have a free caregiver program at the Traeger Institute. The caregiver team can provide the caregiver with referrals to resources, training, support groups, and individual counseling. The caregiver program team can be reached by calling the caregiver hotline 502-588-3322, or you can email traegerinstitute@louisville.edu. So thank you for that.
And Essie, I think, put something on there. If long-term care facility needs an iPad, please call the long-term care ombudsman's office. So that's really good to know.
Really, will they be able to provide iPads?
I'll share with you, we are actually working with the Inspector General's office to get long-term care communities who do not have virtual technology set up. That is something that is in process through the state, and so there'll be more information coming out about that soon. And Dr. Furman, it may be discussed in your task force meeting coming.
That's great. That's a big need.
Yes.
That's very good to know. Thank you. Thank you, Victoria. It was great having this lively conversation with you, and good luck with all the work that you are doing on the state level.
Thank you, and good luck to you all. And thank you for having me. I greatly appreciate it.
Thank you all. Bye.
Happy long-term care week.
Yes.